Hello, hello. Hey guys, it is Michelle over here at the Houston Heights. I am starting the live stream video, and today it's all going to be about threads. So thank you, Shelly, for giving that as a suggestion. I'm super excited that we are going to be talking about that. I know right now it is 1 o'clock, so I did want to give it some time to kind of see what's going on. So I'll give a little bit of housekeeping just until people start coming on to talk about the discussion for threads. So I did want to let you guys know, happy Good Friday, happy Easter and Passover for everyone as well. I do want to let you guys know the clinic is still currently open, even though the med spa aspect of it is closed until May the 1st. So if you still need to go in for your refills and your prescriptions, feel free to come in. The clinic will be open on Thursdays as of right now, so feel free to pop in, call, or text. We will still be taking all your appointments, so on May the 1st, whenever we do open back up, feel free to pre-book that appointment. You can always message me and or call the clinic. There are going to be people who are on the line and following up with you, so feel free to do that. So cool. So today's video, we're going to be talking about threads. There's going to be kind of 4 points that I want to talk about, which are mainly what is a PDO thread, who's a good candidate, the different types of threads that are out there on the market, do they work well with other treatments, and then finally we'll show you the different areas that threads work really, really nicely on. At the very end of this, I will also be going over kind of like a questions and answers portion, so feel free to ask questions if you have them pop up, and or save it to the end because there will be an area for that. So a lot of times people come in and they're like, Michelle, what is this thread lift? I've never heard about this before. So what threads are is they're a dissolvable stitch or a suture that we put in the skin that you'll see an instant lifting result from that will actually truly get better at 30 days because it produces collagen. And the reason why it's producing this collagen is because slowly your skin is connecting. I always like to use this analogy. If you guys have ever had surgery before, you know, they put a stitch in, and then after that stitch or that thread dissolves, it's not like your skin just bleh, like opens back up, right? What happens is when that thread is getting metabolized, your tissues connecting. And so that's really what threads are doing, is they're reconnecting that tissue. And really every year we age, so it's nice. It kind of helps with combating the aging process. So threads, there are a few different types of threads. There's two main categories. There are what are called floating threads or non-barbed threads, and then there are what are called barbed threads. For those of you who have come into the clinic who have done threads with me, you know I'm a huge fan of the barbed threads because they're really the biggest bang for your buck. You get this really nice lifting effect that is very natural because threads do lift without volumizing, so you never have to worry about looking fake or overdone with some of the fillers. But we'll talk first about the floating threads. These are also known as what some people say twisteds and smooths. So they're smaller. I'll show you right over here. They're very little. I don't know if any of you guys have seen thread videos online. You see a ton of these little guys like blah, 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 like injected all in people's faces, and they're like, oh my gosh, that looks so freaky. How many threads do I need to get a good result? Oftentimes they're using these guys, which right here I have a smooth thread. I'm not the biggest fan of smooths and twisteds. We do use them in the clinic, and I use them as well. They just don't last as long. These typically will last you for about 3 to 6 months, and it is something that you have to keep on doing. So think kind of like your Botoxes and your Dysports. You want to come in every 3 months. Same thing with these smooths and twisteds. This is something that you'll ideally want to follow up in a relatively short period of time, about 3 months, to do another set. So exponentially the price of these guys can get a little bit more expensive, but what's great is that they stimulate superficial collagen. So unlike the barbs, which are those deeper subcutaneous injections that are doing more of like that heavy duty structural lifting, these are producing collagen more superficially. So really nice for like fine lines, maybe around the mouth. Some people, actually I like them here in the neck where you would get this kind of kind of crepier skin. They also work really nicely if you want like a subtle little lift around the eyes. I tend to prefer the barbs for those. These also come pre-threaded, and there is a needle. So I want to make sure you guys can see that. So you can see how this is actually a needle, which is going to be different from the way that the other threads come, because those ones are going to be a blunt tip. So you do have a little bit more of a chance for bruising with this this type of thread compared to the second category, which would be the barbed categories. Anyone has any questions about the floating threads or smooths or twisteds before I continue? Awesome. I'll take no as an answer. So cool. So then we're going to talk about the second part of the threads, which are my fave. So these are the barbed. So this is a demo of a barbed thread. It's an 18 gauge. The brand that I use is called Nova Threads. They're actually based here in the United States, California. I have used two different types of threads before. I don't want to name the other one because I really don't like them, and I'm not a huge fan of spreading negativity, but let me just tell you that Nova Threads, they are an amazing company. They've always shown awesome support, and they are like based here in the United States, which is always awesome. USA all the way. While the other ones were manufactured overseas, so that might be why there was issues with them, but really awesome brand. So we'll get back to the barbs. So this is the 18 gauge. What's really nice about this is that it is really pretty big, so you can see how long and how much area you can actually get. How long? I see the change. Oh, so typically this will last you for 12 to 18 months. What's awesome with these barbs is that they are thicker. So if you can see back over here, it's a really nice thickness. They are pre-laser cut, so they have these tiny little barbs or jags on them, and that's how you're able to really kind of create that nice lifting with them. But these, you'll see an instant result that will last you for 12 to 18 months, which would lead us to the other type of barbed, which these are called the infinity threads. Ooh, or the molded threads. Molded threads are really cool because these are actually double the thickness of a traditional barbed. So you're going to actually get about 2 times the amount of lifting with these. And I do just want to show you the difference in thickness. So you can see with this one back over here, the molded or infinity thread is technically the name of it as well. It is thicker, so you're going to get more structural support, more lifting compared to the typical barb, which I use all day long. With this type of thread, since it is so thick, not everyone is a candidate for it. You really have to have good dermal structure in your skin. So think if somebody is really like more so gaunt, not a good candidate for this type of thread because we want some fluffiness, we want some dermal tissue back there, so you won't be able to see this, which is nice. What's awesome with the infinity thread is the infinity thread, it lasts up to 2 years. So this one, there's that range about 18 to 24 months compared to this one, which is about 12 to 18. Like I said, though, not everyone is a candidate for this. So this is a type of thread where if you're interested in, definitely come in for a consult. We'll let you know. Last thing I'd ever want to do is inject like an incorrect product on not the proper patient, because then that could lead to complications. So like I said, on these ones, not everyone. These ones, for the most part, yes, you're safe. I do also want to show you though the difference within the texture of the molded ones. So I don't know if y'all can tell here how it kind of is more of like a little deek type of pattern, and that's what gives a little bit more of that structural support, unlike that laser kind of jagged thread. Cool. Any other questions about these before I go on to who is a good candidate? None? Okay, fabulous. All of your threads, whenever we're injecting them, I do block you off. So it is a very comfortable treatment. So they don't come with lidocaine. So unlike your fillers, for people who have done fillers before, we'll numb you up topically. But then every push we do with the filler, it goes numb internally. What's really cool, and I've actually done this new way of doing threads. So for people who have done threads before with me, like maybe a year or 2 ago, they're so much more comfortable because I have a new way of doing the lidocaine injections. Before, what I would do is just bloop, 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 little tiny boluses of the product to kind of numb it. Now I'm actually doing a little bolus here with lidocaine with epinephrine, so it kind of blanches out the skin, helps with the pain and discomfort. And then right here at the very bottom of it, I'm inserting about 1 to 2 mLs of lidocaine. So as I'm pushing that thread in, it is actually going numb internally. So the treatment's a lot faster and it's a lot more comfortable. So if you have done threads with me before and you're like, Michelle, I love the result, but it was a little cray-cray, a little uncomfortable. Definitely don't let that be a deterrent. You know me, I'm always learning newer and improved ways of doing things. So the new way of doing the lidocaine is awesome. So it's a very comfortable and very tolerable treatment. And if it's not, I always say, just tell me, I'll pump you with more lidocaine, so you'll be fine. Okay, cool. So now we're gonna talk about who is a good candidate for threads. And what I always tell patients is anytime you come in and you're like, Michelle, this is all that I want. Can you give me, just a nice little lifty? And I'm like, yes, actually I can. That is really threads. What threads do and what they do so nicely is they lift without volumizing. So I'm gonna typically show you, like if a patient like myself comes in and they're like, hey, I really just want this nice lifting effect. And what's really great with the lighting right now is that my lighting's pretty pooey. So it's really great to kind of show you how this would really lift up my face. So a problem area of myself would be more so through here, that pre-jewel sulcus kind of marionette area. As women, we tend to struggle with this because as we age, what happens is our face goes down, but then our jaw actually gets a little bit thinner as we get older and retracts back into our face. So then we tend to get these really big kind of puppy dogs. But I'll show you on my own face. So for me, what's really nice is that I would probably do a ventricle or an injection site from here to here with a thread to lift that. Because you can see from here to here, here to here, that's a really nice improvement. So that could be an area for me to lift. So then I just mark it up through there. A lot of times though, when patients come in, they have these big pre-jewel sulcuses through here. So I'm actually a bigger fan of going more picking up north to helping down south. So you can do a lifting effect from up here. And you see anytime you pick up north, it is going to help down south, which is exciting. So commonly I would go injection site from here. So your injection sites are always going to be really close to the hairline. And what's really nice, and I didn't tell you about this with the barbs, but those barbs, since it is a cannula, it's not a needle, your chances of bruising substantially go down because I'm really only poking you one time with a needle back here close to the hairline. So if you bruise, throw your hair down, no one will know. Unlike those smooths and twisteds that are with the needle, you have a really higher chance of getting a bruising, which nobody wants. So chances of bruising with your barbs are a lot more subtle if you have them at all. It's actually not super, super common. But yeah, so we could do a ventricle through there to ding, ding, kind of help with that lifting. Same thing back over here for extra support. I also love them in the cheeks. Like for example, myself, I naturally have really good full cheeks. I don't really want to kind of blow them up more. So what would be really nice is a lot of times just to insert a little thread from here to here. And you can see that this is actually the same area where I would do a lower thread. We call this one more of a mid-face thread to kind of help with that line. So I could do one through here, boom, from the entry point. I could put another extra support down here to help with that pre-gel sulcus marionette area to really create a pretty, pretty lift. And you can see comparing to this side, if I lift it, it softens up that nasal label fold, softens up down here. I would say on the lower part of the face, that's gonna be the majority of areas. I also love threads though in the neck. In our neck, there's not a lot of stuff that we can do. So threads are great because a lot of times people come in with a little bit of this little turkey goblet going on. So it's great with the threads as they can kind of just help with lifting up and creating more of that jawline, which is great. It looks like I have a question. What is if my skin sags underneath the eye from the bottom of the lip on each side? So you're talking about if your skin sags mainly here? Yeah, so typically if this is the area where you're mainly concerned with, your threads are just going to be lifting up through here. They're not going to be lifting up true kind of under eye sagging or under eye bags. Absolutely, that improves it. It improves it by creating this lifting. I do always tell patients, keep in mind when I'm pulling my face, it looks a little cray-cray, like there's definitely some lines and some tugging. The threads are just going to lift back up your skin to where it once was. So you're never going to see any superficial tugging or puckering. But normally we do a thread here to kind of help with the cheeks, which will naturally help with improving the eyes. And then here would be typically your fillers. I actually really love doing combination of treatments, which I'll be talking about kind of right after this. But I do want to kind of finish up with the neck. So in the neck, I really like doing a thread mainly back here. It's kind of hard to do this on myself while I'm doing this, but oftentimes back here to kind of help with a little bit of that turkey neck through here to create that really pretty lift. Depending upon your neck, there is another ventricle that I can do, or trajection area, where it's a little lower. With your barbs, you don't want to go too superficial with them. And in the area of the neck, it's more of a crepier, superficial skin. So oftentimes I'd say 1 to 2 typically is the most I like to do with barbs. I told you before, those smooths and twisteds are really nice here as well. Which that kind of leads us into the third part, which is what are other options that are really nice to do with your threads? I am a huge fan of what is called multimodality, or doing a combination of treatments. Sorry if you covered this, but how do you, oh, great question, Lindsay. So typically with your threads, they do absorb. So it's not commonly something that you'll have to remove, but if you do have to remove it, we can, and I have done 2 thread removals. It's not super common, because typically if you like the way they look, you wouldn't want to remove them. But what you would do is you do a tiny little insertion through here, and then we would just take the thread out and reinsert another thread. But naturally your thread will break down and metabolize. So a lot of times you don't actually have to do a thread removal, because over say like a year to 2 years, they will break down on their own. But if you, for some reason, don't like it, or there's a complication, it is very safe and relatively easy to remove. So great question. But cool. So kind of back over here talking about the multimodality. So what I always tell patients, in an ideal world, what I would want to do first is you always want to relax first. So I'd be doing things like your Botoxes, your Dysports. You'd want to lift second. So that would be really your threads to create that lifting. And then thirdly, you'd want to start volumizing. The other live stream that I did last week, I told you that, after the age of 25, we lose anywhere between 1 to 3 mLs of volume in the face. But really with your fillers tend to be a lot more expensive. Like most fillers that last for say a year to 2 years cost, you're looking about like about 550 to like 600. While with your threads, typically that type of thread you're looking at, if it's on special, anywhere between 4 to 450 is going to be common. And that does 2 areas. So you actually get kind of a bigger bang for your buck, which is really nice with threads. Plus, whenever we do threads first, you don't need as much filler, which you all know I'm a huge fan of making sure that people look very natural, and that's kind of always the goal. So kind of nice to know, do first Botoxes and Dysports kind of to soften up those lines and wrinkles. Y'all know I also love Botox and Dysport in the neck. So anytime I do a thread lift in the neck, you always want to relax these muscles. These are called your platysmal bands, or also known as a Nefertiti lift. You want to relax this because naturally by relaxing here, you will get a little bit of lifting. And then if you need more lifting and contouring, typically your threads would be great. And then this says, how long does it take to absorb? So really great question. So as far as the absorption rate, it kind of depends on the thread itself. Obviously, we talked about the floating threads or the smooths and twisteds. Those are going to get absorbed a lot quicker, and that's why ideally you want to do them a little bit faster, say like every 3 months. I don't really use a lot of those. So the ones that I primarily use would be the barbs. Around about 6 to 9 months, they start getting absorbed. And then typically after they're absorbed, you have that tissue connection that I talked about before. So then that's why it's able to last for about 12 to 18 months for those regular barbs, and then 18 months to 24 months for the Infinity. But they do just start to absorb a little bit faster. So I'd say like around 6 to 9 months is going to be more common. So super good question. Glad you asked that. So keep in mind though, even though we talked about multimodality, like starting off first with your Botoxes or Dysports, going second to your lifting treatments, which would be something like your thread, and then third would be the fillers or the volumizing. You don't have to wait. Like I have some patients who are like, Michelle, I love you, but I fly in to see you. I can't, fly in every 2 weeks to get something done. Can I safely do it all at once? Of course you can. If you do it all at once, you just have a little bit more chances of bruising, a little bit of swelling, a little bit more pain and discomfort that can happen with the treatment. Cool, so then that kind of leads us to the fourth one, which is, what are all the areas that we can do threads on? Threads are awesome because really all they do is lift. So commonly on the face, I don't need any in my brows. I naturally have really super archy brows, but sometimes people have more of a flat brow. So you can safely do threads here to help lifting. So you can do threads mid-face here, back over here if you want a little bit more of this. Gigi Hadid has made this look super, super popular where people want a little bit more lifting out on the sides. Not the biggest fan, but I do that. So if it is something that you like, you could do a thread back over here. I'm a little bit of a bigger fan of using fillers in the temples. I think they naturally will lift it up a little bit more. But yeah, you can do them over here for the brows, here. We showed back over here in the face, the different ventricles for the upper and lower portion of the face. Some people do put threads in the nose. I'm not a huge fan of that. I really think you get better results using a filler to create a little bit more volumizing, lifting, and shaping. Commonly when I do threads, I tend to say threads are beautiful for the outside of your face. So think brows, kind of mid-face, lower face here, and then in the neck, while your fillers are excellent for that front portion. So think more so nose, nasolabial fold, lips, around the mouth, chin. But yeah, so I'd say those would be the common areas over here in the neck. And then I also love it in the body. So I do always tell patients I tend to do more like face and neck, but I've done a ton of arms. So when people come in with like a little loosey-goosey and they're not ready for surgery, threads are a great way of just creating a little bit of lifting and contouring anywhere in the body. But yes, commonly I've done the arms, I've done the abdomen or the stomach. A lot of times when people have that kind of sad face emoji on the belly button, we can kind of help with lifting it up with the threads. Thighs, butts works really, really nice on. Those would be the majority of the areas I've done them on, although I'm sure that there are a ton of others, just kind of waiting to be done. So does it make the nose look smaller? So anytime you do injections in the nose, primarily with like threads and or fillers, what we're trying to actually achieve is more so contouring and shaping. So the answer would be yes. So typically by creating a little bit of a pick-me-up in that nose area, you will see more contouring and lifting. With the fillers, which is what I primarily really like, and I actually put filler in my nose, it's really to more so kind of lift up this area, because as we get older, and you can even see this on my face, and I'm 33, things just vroom, they just go down, right? And our muscles naturally depress down, like my Dysport's wearing off, so OMG, I actually have some movement, which is good, because then you can kind of see what I'm talking about. But naturally our glabella muscle depresses in, right? Depresses in, our eyes depress in. So it's great with doing a combination of treatments. So doing a little bit of the Botox Dysport there, Botox Dysport here, it will naturally lift it. And then doing, say, a filler or a thread in this area will just boop, kind of just pick it up, which is really nice. Okay, cool. That question was in Spanish, so I love you, but I don't understand what you're saying. So awesome. We'll just keep on moving along. But yeah, so that was the main areas that we're talking about with threads. If you guys do have any specific questions on either the areas, the treatment, or anything else that I discussed, feel free to ask. This is kind of that open forum section. You guys know that I love threads because they are such a natural way of creating lifting in the skin that is less expensive than other options like say filler and or surgery. And there's really close to zero downtime. Something I didn't talk about would be like post-procedure threads. It's a really quick procedure. So whenever you come in, depending upon, I'll talk about the price, depending upon how much we do, the price can change. Typically, if we're doing, say, the barbs, which that's really what I do on most patients, they're normally about $450 for the set. So a set would be 2. So that would be, say, like 2 of these guys. So if I'm doing, say, upper face here, on both sides, you're looking at $450, and that would last for about 12 to 18 months. What's really nice is that we are having that kind of special going on that we had before we shut down the clinic. So the more threads you do, the bigger the discount you get, which is awesome. So if let's just say you want to do a thread here and a thread here, instead of it being $450, it would go down to $400. If you do 3, say here, here, and here, or here, here in the necky, here, here, brow, then that would go down to $375 per the set. So great question. Cool. Well, if there is no other questions, then I think that would be the end of the live stream. Y'all, this was such a fun stream today. Thank you so much for everyone participating and kind of chiming in. I know I had a ton of fun. I hope you guys did too. I would love to keep on doing these live streams at least once a week if we can. So if any of you guys have any suggestions on like what we want to do for maybe next week, please feel free to message me. Thank you, Shelly, like I said before, for suggesting the threads. I think that this is a really good one. I can't wait to reopen either. We're planning on reopening the 1st of May. I know I talked about in the beginning of the stream. The clinic itself is open every Thursday. So for people who do need to come in for those prescriptions and the refills, feel free to pop in and or call. They can also do virtual visits, which is really nice. But we will plan on opening back in May. So happy Easter, everyone. Happy Good Friday. And then, feel free to message me if you guys have any questions. Enjoy your weekend. Bye.